I'm Susan Bracefield. I'm the Chief Nursing Officer for the Integrated Care Board for Cornwall and the Isles of Scilly, and we're here today in the System Coordination Centre that's been set up to help us coordinate services over what we know is going to be a really difficult winter period.
Because this has sort of been dubbed, hasn't it, the NHS Winter War Room.
It has. Yeah,
so we're expecting a tricky winter. How will this help, and how will this take the pressure off what we know has happened in Cornwall with ambulance queues, etc.?
So the idea of this is a coordination. It's a coordination over a number of services which all work very well. But the idea is to bring people together to work quickly. So it's about having that agility to respond to any crisis or any pressure that starts to build in the system. The benefit of having our screens is that we've got real-time data. We can see where the pressure's building. We can see if we've got lots of ambulances about to arrive at the front door of ED, and at the same time we can see how many discharges the hospital have got ready to go to allow us to receive those patients in. So the idea is that we get a live snapshot of what's happening across our services.
So are we going to see less ambulances outside Trelisk and that sort of thing then from now on?
That's absolutely the objective, of course it is. And if you look at the last 4 weeks in particular, all the work that the Trust has done, all of the work that our community service has done, the local authority, voluntary sector and the coordination through here, we're seeing fewer ambulances queuing, more, and really important, when they are queuing, they're queuing for much shorter periods of time. The objective, however, is a zero tolerance to having no ambulances queuing. We don't want that because we need those ambulances back out on the road.
So what are you expecting this winter to be like then? What sort of things are going to be affecting the hospital? COVID obviously is still around.
So we know we've got some really great modelling that we have nationally, but we also have our business intelligence team do a fantastic job around modelling, particularly some of those common infections that we see in winter. You're absolutely rightly, COVID has not gone away. It's a virus, it will mutate, we will have different strains. The public in Cornwall have been phenomenal. We have been top of the National League for 2 months in a row for the autumn booster uptake, so huge thank you to our population for responding because that will stop people coming into hospital. We know that flu is going to be a problem. It is every year, but on top of COVID and norovirus, that's another one of the visitors to Cornwall and the NHS in particular. So they have the potential of closing beds down in order for us to maintain and contain those infections. So that's an added pressure on top of a system that was already just starting to show little signs of recovery from COVID. And we know that COVID and flu doesn't only affect our public, it affects our staff as well, and that's staff across ambulance service, across all of our services, and also schools. So you know, when schools are really struggling and children are poorly, our staff have to take time off, which is what you would expect. So we know that this winter is going to be particularly difficult because we know colleagues in other parts of the world, like New Zealand, like Australia and Canada, have had a particularly challenging winter. We follow suit, we know that's coming, so it's about being prepared for that, and how do we get all of our services in a place that our staff feel confident and safe to keep our patients and the people of Cornwall safe.
And we're not in Opal 4 at the moment,
are we?
Opal 3, and the whole purpose of this, isn't it, is to stop.
Yeah, it's to stop us tipping. Ideally, I'd like to say we won't go into Opal. I can't make those promises because we know that the pressure's going to come for us. We know the period just after Christmas it's some of the busiest days that the NHS see, the 27th, 28th, 29th of December in particular. But it's also about the ability to recover from Opal 4. That's what we need. That's one of the big objectives of the coordination centres, is that we're able to pull back from those escalated areas very quickly and return our services to a form of normality that allows us to be able to pace and plan.